I am going to introduce Dr. Wilson. Doni Wilson is a doctor of naturopathic medicine, graduate from Bastyr, natural health expert, nutritionist, midwife, and author who believes it is possible to be healthy even when we're stressed. Who's stressed? Me. After experiencing and recovering from stress herself, Dr. Doni wrote a book called The Stress Remedy. In that book, she redefines stress to include toxins, food sensitivities, and lack of sleep. She explains how these things can cause adrenal distress, leaky gut, blood sugar, and all of these things that she's going to talk about today. Dr. Doni has she's been working for almost nearly 20 years helping women, men, and children overcome perplexing health challenges, underlying causes of their issues. She's frequently called upon to discuss her approach in the media as well as public and professional events. She's contributed so much to the naturopathic profession over the years, and so it is my heartfelt honor to welcome my friend and colleague, Dr. Wilson. And so with that, I'm going to turn it over to you, and I'll jump back on. I'll make my face go away and jump back on when it's time to wrap up the questions.
Thank you. Oh, thank you so much, Joanne, for introducing me and for having me to present today. I really appreciate just the opportunity to get to share what I've experienced both professionally and personally, especially related to this topic of anxiety and depression. And I recognize that some of you who are listening to this presentation, some of you may be interested in naturopathic medicine as a career, and some of you may be interested in as well how naturopathic medicine can help with anxiety and depression. And I also want to recognize that some of you maybe experience anxiety and depression yourself, or maybe have loved ones who experience it. And so I really just want to start out by honoring that and saying that I know it takes sometimes a little bit of oomph to get yourself to say, hey, I want to learn more about this. I want to understand anxiety and depression more, and I want to understand what else is possible. And I think you're going to hear that throughout the presentation today, that if anything I could encourage you is that there's so much possible. Even though a lot of times in the medical community and our societies that we get the feeling that there's nothing we can do about anxiety and depression, and then we often feel like we're at a dead end, and maybe we feel like there's something wrong with us. The person who feels anxiety or depression can actually feel like they're being dismissed or being told that there's something wrong with them and nothing can do about it. And I really want to be here today with the chance to shift that perspective, to say, we see you, we hear you, we recognize that these are real symptoms, and that there's a lot of things that can be done to help. And so with that, I want to just share a little bit about me. Joanne was saying how I've been practicing as a naturopathic doctor for 20 years. And a lot of times people ask me, why did you start? Why did you even choose naturopathic medicine way back then? And the thing about me is that I essentially grew up in a pharmacy. My father's a pharmacist, still is a pharmacist. And so I grew up moving between pharmacies in a chain of 1,200 pharmacies on the West Coast of the United States. And so that was normal for me growing up. But at the same time, around home, my father and my mom were always emphasizing ways to support our health and prevent the need for medications. So it was kind of this ironic mix of being in the pharmacy and also very much exposed to the idea that if we eat certain ways, we can prevent health issues and we can prevent the need for certain medications. In fact, throughout my childhood and my life, I've only taken antibiotics one time. So that's sort of what I grew up with. And also this sense of wanting to spend time outdoors and wanting to be active. And so I really, grew up with that around me. And so when I was in college studying pre-med, I also decided to do a degree in nutrition because I was trying to solve heartburn for myself, and the medications weren't helping. And I was very sensitive to medications anyway. So I ended up solving heartburn with changes in my diet. And that made me think, oh my gosh, is there a type of medicine where I can actually use nutrition and food and nutrients as medicine? And that's when I found out, a friend told me about Bastyr University way back before there was even an internet or webinars. We just had to find out by word of mouth and get in a car and drive there. And so I just saw that a different approach was needed and was possible, even for something as simple as heartburn. And that's how I found naturopathic medicine. And I, walked into Bastyr University and they said, why are you here? What do you want to do? And I said, I believe food can be medicine and I want to learn more about that. And they said, well, we think you're in the right place. And so that's how I got to Bastyr. And I, really then became very interested also in stress and how stress affects us. And as Joanne mentioned, I also trained as a midwife. And so I studied women in labor and fear of labor. I was just actually talking to a patient this morning who's anticipating having a baby in about a month. And we were talking about fear of labor and how real that is. These are these real human experiences that happen. And wanting to understand better what that is for people, and really what that was for myself. A lot of what inspired me and I've been passionate about over the years has been my own experience with health issues as well, including anxiety and depression. So when I was researching women in labor, what I found is that there's a certain amount of stress and fear that's actually necessary in order for labor to work well, in order for the contractions to happen and the baby to come out. We need some adrenaline and we need some cortisol. At the same time, if there's too much stress and fear and not enough support, labor comes to a halt. And I just had this realization one day, wow, we could apply that not just in labor, but we can apply that information to all humans all the time. We need a certain amount of challenge and motivation and inspiration in our lives. We want to be parents. We want to have careers. We want to do things that make a difference. And that requires a little bit of adrenaline and cortisol. It's just that if we don't also counterbalance that with support and self-care, then it becomes this anxiety and potentially depression and other health issues that prevent us from doing the things we really want to do. And so it's about finding this balance in the middle. And so when I graduated from Bastyr, I ended up moving to the New York area in 2001, right after 9/11. So this was one of the most stressful times in New York history, and arguably the United States history. And it gave me this opportunity to apply this theory right away. And I ended up researching more and more about how stress is related to anxiety and depression, and wrote this article that was published in 2009 about how stress and all the underlying physiology that goes behind stress leading to anxiety and depression, which is what I'm going to describe to you today. But you can also get this article if you'd like to read it. And the book that Joanne mentioned, The Stress Remedy, really was born from this research and this article already, 10 years ago, which is amazing. And the Stress Remedy is now, I think, 6 years old. And I continue to write about this topic and speak about it, which is why I'm so happy to be here today, because I really feel like this is so important. And I think it's becoming more and more important every day that goes by. And what I actually feel excited about is I think more and more people are starting to see this and realize it and recognize that it's important. And that, because for a long time, stress is something that we would dismiss. We would kind of think, well, stress is something we all have. We are supposed to just deal with it. And it's almost sounds cliche, right? We almost are just like, that's just there and nothing we can do about it. We just got to power through it. And we can become almost like what I call superheroes. We think we're superheroes, or we think we're supposed to be superheroes. We think we're supposed to be able to get through stress and not have it affect us somehow. And the fact is we're human. We are human, and humans, yes, are built to be exposed to stress and respond to stress, but humans also need anti-stress and recovery from stress. And so let's dig in more about this.
We'll
Oh,
jump
yeah.
in really quick. Before you get going on the rest of this, we have a quick poll just to see who's with us today
Oh,
and
great.
where they're joining us from. And so we like to do that just so we know who's in the audience. So keep going, and we'll just run the poll while you're talking.
Okay, well, this is perfect because I know that, like I mentioned, there's so many different potential interests and reasons for listening today, and certainly if you have questions, write them in so that I can come back to them. But here's just to point out the incidence of anxiety and depression, at least what's being recorded. I think that from my experience, a lot of people experience forms of anxiety and depression, and it may never be diagnosed. You may not even realize that that's what you're, because we call it different things. Maybe you call it feeling restless or having worry, or maybe for you it just feels like your heart's racing or you can't sleep, or with depression the same. There can be I'm just going to shift that over here. 7% of adults have had at least one episode of major depression, but there's also 1.5% that just function with low-grade depression all the time, called dysthymia. And in terms of anxiety, it's also very common as well. Oh, for some reason, oh, there it goes. And so I think that anxiety and depression are probably even more common than these numbers reflect. And I'd be curious if you found the same or if you've noticed the same. So then let's think through. This is one of the difference, by the way, with naturopathic medicine, is naturopathic doctors are really trained to ask about the underlying cause. Yes, we can see the anxiety, depression, we can identify it, but what's causing it? Because essentially, if we can address the underlying cause, that means we can get it to go away. We know what to do to solve it. So instead of just focusing on the symptom or the diagnosis or the condition and trying to treat it, say with a magic pill or a band-aid effect, we're going to go, what created these symptoms, these signals from within our body? These anxiety and depression is really a signal from our body saying, I need help. And we, as naturopathic doctors, can come in and say, okay, I hear and see that you need help. Let me understand what help is needed. What's going on underneath that I can then help resolve? And a lot of times it could be very simple things. Even maybe someone just needs more sleep. Maybe someone needs more help in their home. Maybe, there could be very simple things that could solve it, but we just need to first start by saying, what is it? What's going on in this situation? Because it can be very different for different people. And I always put stress at the top of the list because to me, stress includes, yes, everything from financial stress and day-to-day stresses, as well as we know that even stress from childhood and certainly major traumas are stresses. And also there's the stresses that we deal with day-to-day. And I would argue that stress also comes in the form of certain foods that are a stress to our system, toxins in the environment that are a stress to our system. Sometimes it can be a lack of food or too much food. It could be lack of sleep. So anything basic, as humans, we are built to deal with stress, and our bodies are constantly through our senses, from our sight, our hearing, our touch, we're picking up on our environment in all ways. And if our body picks up on anything that it needs to respond to, that's essentially a stress. And when our body's responding to those stresses, it's creating a stress response cascade that I'm going to talk you through here. Just to touch on these various causes of anxiety and depression that we're going to talk about, as there can be inflammation. This is one that there's been so much research in the recent years showing that anxiety and depression is very much associated with inflammation in the body and inflammation in the nervous system. And I like to point this out because a lot of times we've been told that anxiety and depression are chemical imbalances. And somehow when we hear that term, chemical imbalances, it almost seems like it's stuck, like there's nothing we can do about it. But that's really not true. And which are the chemicals they're referring to? So I would say, hey, there's a lot of potential I call them more like messengers in our body that can get out of balance. Even our nutrients can become deficient for various reasons. Our neurotransmitters can become imbalanced. Our neurotransmitters, like serotonin and GABA, for example, are made in our bodies from nutrients. So if our nutrients are out of balance, of course our neurotransmitters can get out of balance. And if we have inflammation from various causes, this then triggers the nervous system to create these signals that we call anxiety and depression. There could be hormone imbalances. And there's also this connection with our digestion and our nervous system that's such a huge realization. We used to think that our brain and our body were so separate, and that what was going on in our mood or our brain was separate from everything else. But we know that that's not true anymore. We know that we're interconnected, and this is also very much a principle of naturopathic medicine, is that we're a whole body, a whole system. There's communication happening amongst all of our systems all the time. And this connection between our digestion and our nervous system and is a two-way road. We used to think, oh, it's just our brain communicating to our digestion, but that's not the end of it. The digestion communicates back to our nervous system. And by understanding that complexity and how we can even say make changes in our digestion that can affect the way we feel and our mood is huge, right? So to me, I just go, wow, I'm hoping when you look at this list that you go, wow, there's a lot we can do to understand the causes of anxiety and depression and to address them so that we can make a difference. And yes, genetics do play a role, but what we now know about genetics is we can't blame the whole thing on genetics. Yes, genetics can be, say, 10 to 20% of a predisposition, but what we also know is the thing that turns on a genetic predisposition is stress exposure. When we're exposed to stress, which of course we all are, it turns on our genetic predispositions, including for anxiety and depression. But the other key piece is that by addressing the stress, we can also turn off the genetic predispositions. We can help. Genetics are not set in stone. The genes are set, but that doesn't mean that the effects of the genes are set. We can actually influence what plays out from our genes based on what we do with our body and our support related to stress exposure. So I just want to go into a little bit more about this stress response and show you how these various causes are actually interconnected. So here's cortisol. Now, cortisol is our main stress hormone. And cortisol, we don't want it to be zero. We need cortisol. We need it to be higher in the morning and gradually decreasing through the day, sort of like this curve here, where it would be higher when we wake up in the morning and gradually decreasing so it's low and allows us to sleep through the night. The thing with cortisol and depression and anxiety, for example, is the studies show that if cortisol is either too high above this curve or too low, you can have increased risk of anxiety or depression. So really, again, just like we learned from women in labor, we need an optimal amount in order to function well and feel good as humans. We don't want too much or too little, but we also want our body to be able to respond when we're stressed. Now, the thing is that we're stressed, we tend to be stressed so often, right? We tend to have, especially, certain times of the year, we have just stress coming in from every direction. And so what can happen is instead of having a stress response, like I guess the healthy way would be what we want our body to say the alarm goes off. We want the cortisol to respond and the adrenaline to respond, and we want to be able to respond to that alarm. But then when the alarm is off, we want to calm back down and go back to resting mode. What can happen is when we're constantly exposed to stress, the cortisol and adrenaline happen, but then the brain gets confused and it thinks it doesn't understand to turn off the stress response. It thinks the stress response needs to keep going. I call it getting stuck in stress mode. And getting stuck in stress mode looks like potentially having high cortisol or adrenaline a lot of the time, even if you're like, wait a minute, there's nothing stressful going on. I feel fine. Why is my cortisol and adrenaline still responding? Well, it's because the body's anticipating the next stress and it's stuck in stress mode. But we can get it unstuck, and I'm going to tell you more about that in a minute. The next piece of the stress response is to understand that it affects these different systems in the body. What I do with reviewing the research is I look for patterns, and what I see is there's a pattern of how cortisol affects 4 major systems in the body. Again, this is how our body is interconnected. It affects our hormones, all the hormones. So thyroid, insulin, estrogen, progesterone, testosterone all get affected by a stress response and cortisol. Our digestion gets affected. Think about when we're stressed and we get butterflies in our stomach, or ulcers, or IBS, right? Irritable bowel syndrome. That's a stress effect on the digestion. We also know that our immune system gets affected when we're stressed. We know that when people are stressed, they're more likely to catch a cold or other viruses. We also know that people are more likely to have autoimmunity when they're exposed to various forms of stress. And we know that the nervous system gets affected by stress as well. And that's where we start to see neurotransmitter imbalances and mood changes. But also, for some people, it could be migraines. That's a lot of what happened for me, was migraines. And it can also cause other neurological symptoms, neuropathy, dementia, and so on. So this is to show you how the effects of stress over time affect these 4 systems. Now, for some people, it might only really show in one system or another, but some people, they start to realize, oh my gosh, I'm having symptoms, signals from my body telling me that stress is affecting all of these systems. And as that starts to happen, what we see is some other patterns that occur. One is with stress. In the digestion, what develops is something called intestinal permeability, or it's also referred to as leaky gut. It's when the intestinal cells are not as healthy as they could be, and they're allowing undigested food and even toxins from bacteria to leak through the intestinal walls into the body. And this becomes another stress of inflammation, and that signals through that gut-brain axis to our nervous system. So this is, again, just trying to connect the dots a little bit so you can get a sense of how this stress and effect on the digestion can lead to symptoms in the nervous system. We also know that stress, it disrupts hormones, but especially what I call the carbohydrate metabolism, which is our blood sugar levels and insulin function. And when that starts to happen, that also becomes a stress from within our bodies that sends more stress signals and becomes a vicious cycle, really, where if you see at the lower part of this diagram, and this is diagrams from the Stress Remedy book, you'll see the adrenal distress is when the cortisol and adrenaline is in a constant stress mode, or sometimes getting depleted by stress mode. And we have this leaky gut and carb metabolism imbalance, which then affects these 4 systems. And that's creating the symptoms, the various signals and symptoms, including anxiety and depression, which we're talking about today. So starting to flip it and see that anxiety and depression is really the outcome of an underlying process that is triggered by the various stresses that we're exposed to and our genetic predispositions as humans. The amazing thing, and this is what especially naturopathic doctors can help you to do, is to test these levels. So it doesn't have to be a mystery anymore. We can actually measure your cortisol levels and patients' cortisol levels. We usually test it 4 different times a day: the morning, the middle of the day, the evening, and the bedtime. So we can compare it to that healthy cortisol curve. Is the cortisol going too high, like this top diagram, or is the cortisol dipping too low? Because here's the thing is, when it comes to natural approaches, whether we're talking about herbs or nutrients, or even sometimes pharmaceutical approaches to help with cortisol, we need to know what the level is so we give the right treatment. Different herbs will help decrease the cortisol from herbs that help raise the cortisol when it's too low. So for me, I'd rather know as much detail as possible. And once we have that information, then we can actually make choices that are very specific to that person. We also can do tests to understand this gut-brain axis and leaky gut. We can do food sensitivity panel, which is a blood test. There's various labs out there that do this kind of a panel, but they're looking for antibody responses and immune responses to foods. And this can tell us about not only the foods that might be triggering inflammation to the nervous system, but also tells us about how severe is the leaky gut? Is it mild, moderate, or severe? And what do we need to do to help restore that? We can also do, there are tests that actually test for leaky gut, and those are possible also. And there's tests, stool tests, that can help us analyze the bacteria living in the digestion, because we also know that those bacteria, that what we call the microbiome, have a huge communication and influence on our nervous system. They're part of the gut-brain axis. And so it's, a lot of times people will think, okay, I'm going to take a probiotic, I'm going to eat fermented foods, and that can be great. But if you think there may be an imbalance in your gut-brain axis or your gut bacteria, then what could really help us get specific information is to do a stool test where we can measure the bacteria, not just as a culture, but we can measure the bacteria based on their DNA and know exactly who's living in your digestion. And we can see, are there maybe some overgrowing bacteria, or do you have too little of some bacteria? And then we can address them. We can also do tests like blood tests to know thyroid. Actually, it's important to know that it's known that low thyroid function, one of the symptoms is depression. And one of the symptoms of high thyroid function is anxiety. So anytime someone is experiencing anxiety and depression, we really need to check their thyroid. We also need to check their blood sugar levels, right? Because I was just mentioning that, and we need to check nutrient levels. But there's specific ways we can check nutrients, and that's another thing that naturopathic doctors really are good at, is knowing, how can I really know my nutrient levels? Do I need more folate? Do I need more B vitamins? Do I need more minerals? We can do this type of blood work and other tests to find that out. We can also measure the neurotransmitters. So we can actually measure serotonin. We can measure dopamine. These are these neurotransmitters in our nervous system that we're counting on, and they get affected by stress. So of course they can get imbalanced for all of us. And as humans, that just happens. And so we need to do a test. We can do a urine test to see what's the level. This is my cat. You can see his whiskers there. What is the serotonin level? And then again, neurotransmitters are made from nutrients. So if we see that the level's too low, we can give nutrients. I'll show you to address it. We can also measure estrogen production. I like to do that with a urine test. We can do tests like organic acids. We can look for toxins, because toxins can also be a stress that affect our nervous system. So I really just want you to know that these tests are possible, and they might not be happening at the regular doctor's office in a regular clinic. If you get to a point where you're really wanting to do more for your health, and you're thinking, oh my gosh, more is possible. I want this information so I know how to be an advocate for myself and feel better, then you may need to be choosing working with a naturopathic doctor to help you to get this information you need. You can also know your genes. We can do genetic testing to understand what influence that might be having in terms of need for certain nutrients and processing of neurotransmitters. And like I mentioned, then we can actually do something about it. We can actually help these genetic predispositions so that it doesn't have to affect your life and your day in a negative way. So when we think of the approaches that a naturopathic doctor can offer, often you'll see a list like this. We usually will start with anything that would be lifestyle, like just your day-to-day, what do you do when you wake up? How much sleep are you getting? Are you getting some time outdoors? Just some basic self-care, I would call it. And a lot of times this term self-care can be a little cliche also. We almost think of it as like a massage and a pedicure, which are sometimes can be wonderful ways to take care of ourselves. But self-care to me also actually starts with the C. I just use the word care to remind us. The C is for clean eating. So this is to say, and this can be very different for each person, but let's find out the food allergens. Let's take out the sugar. Let's clean up your diet, because we know that having healthier foods, organic, healthier, nutrient-filled foods is going to be better for your body overall, including for your nervous system. Getting enough sleep, which is at least 7.5 hours a night. And then doing stress reducing activities. I don't like to emphasize that we're going to, our goal is not to have zero stress. That would be impossible. That would not be a human thing. We need some stresses. We just want to choose our stress. We want to choose our anti-stress to counterbalance the effect of stress, to make sure that we have some downtime. And so that's the R in care. The E is for exercise or movement, making sure that we have ways to have, and then that might be starting with very little. If you've not been moving, we're not going to say go run 5 miles. We want to really modify it and choose a type of movement and activity that matches for your body. We don't want to stress ourselves more, right? With any of these changes, we want to implement it in a way that doesn't stress us, but does help us. Naturopathic doctors often will start with those type of recommendations. In terms of anxiety and depression, naturopathic doctors are also trained in psychology and counseling techniques. I do encourage you, however, to know that all of naturopathic care is, the scope of practice is based on the state. So depending where you are or where you practice as a naturopathic doctor will determine how much you may have some of these approaches in your practice. And I think that for anxiety and depression, it's often, especially if the symptoms are severe, it's going to be important for the patient to have a therapist, a psychotherapist, and potentially a psychiatrist that they're working with as well, because we always want to make sure that a person has as much help for their symptoms as possible. And so, for other conditions, even for, say, it was a digestive issue, we would want that person to have a gastroenterologist, a specialist, to oversee them. For anxiety and depression, it would be important to have a mental health specialist as well. But naturopathic doctors are trained in psychology and can help with these conditions alongside the specialist. There's diet changes, there's nutrients and herbs that naturopathic doctors are trained to use, as well as homeopathy. And some naturopathic doctors may use more or less of these approaches, again, depending on their interest and their focus and their location. And medications. It's not that naturopathic doctors don't use medications, or we're not anti-medications. We just know, and we actually are trained in the interactions between natural products and medications. So naturopathic doctors are probably the experts, most expert in interactions between medications and natural substances. And we have that in our training. And again, depending on the state and the scope of practice, naturopathic doctors may also prescribe medications or potentially help patients with coming off of medications when it's appropriate. So it's not, I want to emphasize that it's not that medications are not used or spoken about negatively. It's more like, let's see what else the body needs to help so that maybe you can become less reliant on a medication, because a lot of times medications have side effects. And sometimes they don't completely solve the symptoms. A lot of people have been taking medications for anxiety and depression and still have symptoms. So what our interest is how can we help so that you can feel your best and be your best person and do all the things you really are wanting to do in your life without having to experience the anxiety and depression in such a way that's, because they can definitely be, a way of not only the pain that's experienced, but also the emotional pain, but also the risk and the ways that it can negatively affect your ability to do things that you would like to do in your life. So let's see, I'm just peeking at the time here. I want to make sure I have enough time for your questions. So I want to just go through these approaches a bit here. So in terms of diet, one of the first places that I recommend starting is with blood sugar balancing. Again, when we're under stress, it throws off our blood sugar levels. And if we're eating in irregular patterns throughout the day, either going too long without eating or having too large of a meal or having too much sugar, it's going to affect the way we feel. It's going to affect our nervous system. So this is a place that you could start right away, is just having small, frequent meals with less sugar and more balanced with protein and fat to balance your blood sugar. And it's amazing to me how sometimes patients will come back after just doing that and say to me that they feel at least 50 to 60% better from anxiety and depression and other symptoms just by helping to balance their blood sugar levels. So it sometimes is that simple. We also want to make diet changes so that we can address this gut-brain axis. We want to heal the leaky gut. We want to reduce inflammation. We know that inflammation from the gut and the diet can get to the nervous system, so we want to address that. We want to make sure that you can actually absorb the nutrients from your food, and so that's, and so eating foods that have nutrients and can get digested, that's important. We want to address the gut bacteria, and what we also know about gut bacteria is that they are fed by the food we eat. So what we eat actually determines our gut bacteria. So we want to make diet changes so that we're feeding the right bacteria and not the wrong bacteria. And essentially to help with this gut-brain axis so that you can use your digestion to communicate in a positive way with your nervous system. We can also look at nutrients. Now there's some nutrients that are generally in the research looked at for helping with anxiety and depression. But I like to emphasize, and this is part of naturopathic medicine, is individualized care. So we're not going to just give the same nutrients to everyone. We want to know what nutrients are specifically important for this person. Does this person have an MTHFR gene like I do? In which case they might need a little bit more methylfolate. And so we need to test. We need to find out about the genes. We need to know their current methylfolate levels. And do they need a little bit more? Do they need a lot more? Or maybe they need less. We can do nutrient tests to understand. We can look at the neurotransmitters and understand which, if the serotonin is low, then we can use certain nutrients. Here I have this chart that shows us, say here on the right where we have serotonin, which by the way leads to melatonin, which is our main hormone for sleep. But if you look up backwards on this chart, you can see that serotonin comes from something called 5-hydroxytryptophan or 5-HTP, which comes from tryptophan, which is an amino acid that comes from protein in our diet. So when we are looking at diet as well as nutrients, we can use these nutrients to then influence our neurotransmitter levels. And this is using amino acid therapy, it's called, is something I've been doing for about almost 20 years. And it takes practice. It takes time to really start to understand how to do this. So I would definitely recommend working with a practitioner who has that experience to help you. Or if you're thinking of studying this and offering this yourself, you would want to, oops, what happened there? I guess it just went out of play mode. Okay, there we go. We want to be able to work with someone who can really help you to, because this can look complex when you first look at it. But the main thing I want to share is to just emphasize that these neurotransmitters come from nutrients, and we can, as we know which nutrients we need more of, then we can give those amino acids and the nutrients that help with the production of the neurotransmitters to actually change the levels, to actually, if your body needs more serotonin, we can help your body make more serotonin, versus the way medications work is by affecting the receptor that manages the breakdown of the neurotransmitter. It's not working by giving the nutrients to make more of that neurotransmitter. And so it's a really good distinction to know that these neurotransmitters are not far off in a mystery place. These are testable and adjustable using clinical nutrition, which is what naturopathic doctors are trained to do. We can also look for other conditions. I mentioned thyroid before. There's also something called pyroluria and other conditions that affect nutrient needs. And so we can use this to help us understand which nutrients are needed. Here's some examples that have been found in the research. Omega-3 from fish oil has a lot of research showing benefit for anxiety and depression. Same with the B vitamins. These are often researched and shown to be helpful. Magnesium is a favorite for me as a starting place because magnesium helps with breaking down adrenaline. So if the person has too high of adrenaline and therefore that's triggering anxiety, magnesium can help drop that adrenaline level. And so the anxiety can come down. I mentioned 5-HTP, which is a precursor nutrient to serotonin. And sometimes also we'll use antioxidants like vitamin C and CoQ10, which have been shown to help also to rebalance the nervous system and help with anxiety and depression. So this is to show you that there is research on nutrients, and what as a naturopathic doctor we would do is work specifically with the person to see what doses and which nutrients are going to work best for them. We can do the same for herbs. We want to understand based on their genetics and their hormone imbalances and their, maybe if there is leaky gut, we're going to use certain herbs. Or if there's an imbalance of gut bacteria, we can use herbs to address those bacteria. If there's toxicity, we can use nutrients and herbs to address that. Yes, St. John's wort is an herb we often hear about for depression, for example, and it can be very effective. And it is used by naturopathic doctors for that purpose. But we also are going to be looking at what herbs are going to fit for this person to get at some of these other underlying causes of the anxiety and depression. We can also use homeopathic remedies. Usually with homeopathy, it's about understanding the specific symptoms for that person and then choosing a homeopathic remedy to help. Homeopathic remedies are dilutions of substances. So it could be a dilution of an herb or a mineral or other substance. And so it's working on a very energetic and subtle level to help rebalance the body. And for some people, these are the best approach because they're very gentle and very specific and sensitive, and they can be used alongside other approaches. I wanted to share this case study with you, and this is a patient, a 46-year-old woman who has actually several of the things that we've just been talking about going on all at once. So I want you to know that sometimes the cases are not this complex, but sometimes they are. And for her, she's a mom. She was experiencing depression as well as anxiety and insomnia. Sometimes those go together. And so she was taking medications for each of these things. She was taking lorazepam for anxiety, and she was taking Zoloft for mood and anxiety, and she was taking Remeron for sleep. And she just felt like she wanted to feel better. Even with taking these medications, she was still experiencing symptoms and side effects. And she really wanted to be able to get to the underlying cause and feel better and hopefully not have to take so many medications. So in her case, just to give you a sense of it, what we do as a naturopathic doctor, we're going to look at all these different underlying causes. She does have low thyroid function, so we need to make sure that that's addressed. She also has pyroluria, which is a condition that means that her body needs more vitamin B6 and zinc in order for her to not feel anxious. From that cause, she also had these MTHFR and other genes that also would affect her nutrient levels and her neurotransmitter levels. She was exposed to mold, so she had mold toxicity, which can also affect the nervous system. She had imbalance of her gut bacteria. She had a gluten sensitivity. Gluten, by the way, is is a food from wheat, right? From anything made from wheat, actually wheat, barley, rye, and spelt have gluten in them. And gluten is associated with leaky gut, but it's also associated with neurological issues, including anxiety and depression. In fact, even though we usually think of gluten as something that causes digestive issues, like people think of diarrhea or bloating, actually for 60% of people, they don't experience any digestive symptoms when they eat gluten. They only experience anxiety, depression, or other neurological issues. So I really like to emphasize to think about gluten for someone who's experiencing anxiety or depression. This patient also had low iron levels, and iron can also create, it has an effect, it helps with processing neurotransmitters, and it can create fatigue. She also had low copper and low homocysteine. See, this is the thing is that some people with MTHFR, we usually think of having high homocysteine, but this patient actually had too low homocysteine. So it required a different angle to help get her B vitamins levels back on track. She had high adrenaline, and she had a low cortisol. So sometimes these don't all go to, you would think if someone has high cortisol, they have high adrenaline together, but not always. You could have high adrenaline and low cortisol, and it's my job to help get them back aligned with each other. So these are the steps that I think of in my protocol. Step 1 is get out of stress mode. So we want to eliminate the stresses. Like for her, with gluten, was one of the main stresses in her diet. We need to decrease that adrenaline. I mentioned magnesium. That's a great one for her, is to use magnesium to help decrease adrenaline. We also need to help get the mold toxins out of her body, which we can do using an herb called yucca root. So we start with getting out of stress mode and removing the stresses and the toxins that we can remove from her day-to-day experience. Step 2 is to rebalance and restore. So we need to rebalance those gut bacteria, heal the leaky gut, address those nutrient imbalances and hormone imbalances, as well as the homocysteine. So we need to just get everything back to balance again, including her cortisol and adrenaline. And then once we get everything back into balance, it's all about what I call stress resilience. How can we help her become very resilient to her ongoing stress? Of course, as a mom and having a job and being a human in this world, she's going to be stressed. So how do we help her maintain her diet and her digestion and her nutrients and her hormone balance so that she doesn't fall susceptible to the same situation over again? I think I've shared some about what I love about naturopathic medicine throughout this presentation, but I just wrote a couple of things here just to help summarize, which is to say that naturopathic medicine is really based on this belief that our body can heal. Our body's changeable. It's not stuck. When we have symptoms, they're just signals telling us that something needs attention. We just need to give our body what it needs, and it will respond and can actually shift, which sometimes when you've been feeling some way for a long time, it's hard to believe that it could change. But as a naturopathic doctor, I'm here to say to you that most every situation, the body can respond and can change, including the nervous system, especially when we address the root cause. So it's all about understanding what's really going on here so we can get at that instead of trying to focus on some magic pill or a Band-Aid effect to get us back to feeling good again. Naturopathic medicine also has a belief that education is important, and I really believe this and see this with my patients. The more that people understand their bodies and understand what's going on, the more likely they can feel better, and the more likely they're going to be able to keep on feeling better over time, because then that's going to influence the choices we're making, because we understand why we're making that choice. And most of all, I love that naturopathic medicine is about empowering patients to be their own advocate, to say, don't just depend on the medical system or someone else to determine your health and your life. Be dependent on you. You get to choose each day how you want to live and what you want to do to support your health. And we're here to help you. We're here to help give you the information and the support and the knowledge to be able to make those choices for you and for your health. Let's see. So for me, I'm looking forward to doing more of this, more of sharing information about from my experience and just from working with patients. I've learned so much from my patients over the years, and so I look forward to doing more writing. I'm planning to write another book about stress in terms of what I call our stress types. What is your stress type, and what can you do in terms of these things we talked about today to help become more resilient to stress? Let's see what I wish I knew. Let's see. That's a good question. I might have to think about that one for a minute. I think I just wish I knew that what matters most, I think, of anything for people is not necessarily the degree or the expertise. Like sometimes I just want to talk to you as if I'm just Doni Wilson. I've experienced anxiety and depression. I've had to search out these answers too. And I wish I knew that sooner, that yes, having the degree and the education allows me to be a professional and I can serve people in that way. And in states where there's licensure and insurance coverage, patients can actually see me and receive that help under their insurance plan. But at the same time, I think what can help people most is just connecting on that personal level and being willing to just say, hey, I've experienced this too, and this is what I've learned. And that human connection can really make a difference. Okay, well, here's a bit about how you can reach me, and also about the books that actually, the Stress Remedy book on the right, the Stress Warrior book is a book I published about a year ago, also about stress, and really bringing in a lot of these concepts that we were talking about today, everything from genetics and neurotransmitters and leaky gut and how to address it. And you can find both these books at Amazon. The Stress Warrior book you can also read online on my website at thestresswarriorbook.com. I think it's actually or just stresswarriorbook.com. And this is where you can find me online. I'd be happy to have you. I write blogs and I do interviews all the time. So I'd be happy for you to jump over to my website and sign up so that you can, hear more from me, especially if this has been helpful. I always love to connect and hear more from you. So I'm hoping maybe you all have some questions for me. What do you think there, Joanne?
Yes. So if you go to the next slide really quick, we'll just
Okay. Mm-hmm.
So AANMC has monthly events like this one every month. And so next month we have, if you're thinking about a career shift, we have 2 doctors who have changed careers. We also have a webinar on eating disorders coming up in February as well. So with that, I'm going to just give you a couple questions here. There are a bunch that have come in. So if you can try and keep your answers as tight so we can get to as many as possible, that would be awesome.
Okay.
So one example would be working with patients who have been taking maybe pharmaceuticals like Prozac for a long amount of time. Is it ever able to get off? I know that a lot of people feel like, oh, well, now I've been on this for so long, I can't get off. Can you speak to that just briefly?
Oh yes, and that actually I didn't say from the case that I mentioned. She now has been feeling better from the approach that we've been taking over the past year, and she's been able to very gradually decrease her doses. And the careful thing is, you're always working with the prescribing doctor, and you're always wanting to make sure that you feel better first. Some people think, oh, I have to come off the medications before I can do any naturopathic approaches, and that's not correct. It's actually better to stay on your current doses, start implementing, work with a practitioner who can help you, start implementing, and as you feel better and maintain, then you can very slowly come off of these medications, because the medications do have withdrawal symptoms, and it's very important to have someone help guide you through that. So my answer is yes, it's possible, but you want to do it with the right support to do it successfully.
Thank you so much. So there are a bunch of other kind of angles on this, but one is about cortisol. And there's a question: if cortisol naturally decreases inflammation, why is there so much inflammation associated with anxiety?
Mm-hmm. So I love it, because that means to me that I got you thinking about all of this. And it's true that, like, when we think of cortisol, one of the medications is prednisone, which is cortisol. And so sometimes prednisone is used when a person's having a lot of inflammation, like say there's inflammation from an autoimmune condition or an allergy reaction. A patient will take prednisone, a high amount of cortisol, to turn off the immune system, essentially, which turns off the inflammation. But what we also know is a person is not going to do well if they stayed on prednisone forever, right? If they stayed on prednisone for a long time, we start to have negative effects of high cortisol. They start to experience depression, along with different weight gain and sleep issues and skin changes. And so we can use high doses of cortisol for a short period of time, and then we have to wean off very carefully, because it's not about You can't stay on that high cortisol all the time. It's going to create the symptoms. So just know that it's not as clear. Like, I think sometimes we wish something was as clear as black and white, right? We just wish, okay, it's going to be black or white. But actually, this is exactly a situation where it's gray. We're working in this middle zone. We need to get the balance. So we need a balance of cortisol, actually, to maintain an anti-inflammatory effect over the long term, if that makes sense. So yes, for short-term effect, high cortisol will turn off the immune system and drop inflammation, but it's going to cause a lot of negative effects we have over the long term. So we need to find a way to have zero inflammation or low inflammation over the long term. And that's what we're going for anxiety and depression.
Thank you so much, Dr. Wilson. So another question came in about drug-induced nutrient depletion, and for your patients who are still taking pharmaceutical medications, what is your approach there?
Well, definitely. And it's true. That's a really good point that, medications can cause nutrient depletions. And so it's important to work with, this is exactly where naturopathic doctors can help you to know, hey, based on your medication, which nutrients are likely to get depleted. Let's do some tests and find out if they're depleted. And then let's get you the right doses of the right nutrients to help with that depletion. And that can make a big difference, because otherwise, you might be taking a medication and having symptoms worsen because it's depleting nutrients that are important, right? So it's like, okay, we got to do a combination. We need to do the medications along with addressing the nutrients at the same time.
Fabulous. Thank you so much. I know we don't have too much more time for questions here, but you mentioned how important sleep is. And for folks who wake up early, can you speak a little bit about that? I know there are questions about melatonin versus 5-HTP and blood type diet and things of that sort, and kind of how all of that plays in. But sleep is a big topic, and I know we've only got 2 minutes left here, so.
Okay. And I would say, I love all of those thoughts, because it tells me you're thinking of, yes, there's so many there's dietary changes that can make a difference. There's nutrient changes that can make a difference. What I would emphasize is we want to be specific to you in your case. So this is where meeting with a naturopathic doctor can help you to say, hey, is the blood type diet going to help me? Hey, is sleep an issue for me? One of my other books, which I didn't mention, is actually called The Natural Insomnia Solution. So if you're wanting more help with sleep, I encourage you to check that one out. It's at Amazon for, I think, $2 or something. And you can actually, if you come to my website, drdoni.com, I have a offer where my office will send it to you for free. So I'll be happy to send you the Natural Insomnia Solution. And so you can read more about it, because the thing with sleep is that it really, again, varies. Some people are staying up too late at night, which I call a night owl. And that could be because your cortisol and adrenaline's too high at night. Other people might be waking up too early or in the middle of the night, and that would be a different scenario. And so we want to see, I would test first. What is your cortisol doing? Is it high at night or low in the morning? What's it doing? What's the adrenaline levels? What are your neurotransmitter levels? Because here's the thing is, I love that you guys are already at stage 1 for me, which is you've accepted that you're human and that your bodies are affected by stress. I can hear by your questions that you're there already. Step 2 is, let's gather the information that's specific to you. Let's get some tests done so we know exactly why you're waking up early. And then step 3 is you can use the nutrients and herbs and the diet changes that are specific to your situation, so that if you're waking up early because your cortisol is too high at 4 a.m., let's use the herbs that help drop the cortisol at 4 a.m. But we need to know first, is it the cortisol that's causing it, if that makes sense? So definitely all of this is possible. And I love that you're engaged. It's going to be a matter of now working with a naturopathic doctor who can help you really solve that, and then really understand your body so you know what to do going forward to maintain it.
Thank you so much. So we are pretty much out of time here. For those of you who did not get your questions answered, feel free to email us at info@aanmc.org. Dr. Doni also put up her contact information as well. But I appreciate so much you all coming and spending time with us today. And Dr. Doni, thank you again for your assistance in this really informative webinar. We've had a lot of folks just chiming in and telling you thank you. So just wanted to pass that along, that your information is really valued, and we appreciate your time today. And so with that, we're going to conclude our webinar, and appreciate all of you, and check out future events here with AANMC.org.